So medication optimization is an approach to medication management that focuses on all aspects of the patient's journey, that is looking at the patient as a whole. When we talk about patient safety across the continuum, we don't mean in the individual silos. We mean from the patient's perspective, that journey of going from hospital to doctor to home to skilled nursing facility, back to hospital, etc. Following up on that treatment plan, and then ensuring we have the appropriate review mechanisms to make sure that the patients aren't being harmed by the medications we gave them. In a study we did quite a while ago with Dr. Tejal Gandhi, we found that there were patients who were experiencing side effects, adverse effects from medications. And they would either make the decision to stop taking the medication without consulting, or they would continue to bear through it. And that adverse event now became a serious event because it could have been minimized, it could have been mitigated had we only had the mechanisms to constantly review, communicate with the patient, and support them in their plan. Next slide, please. So what are the principles? Well, we start with what matters to the patient. That is, there are situations where if the patient is in an intensive care unit, the patient is coming to the hospital, serious infection, we have to use our skills to be able to help that patient. But when we're treating patients with chronic conditions over a period of time, we really need to understand what matters to the patient. What is it that the patient can actually accomplish? And to me, as we work on understanding that and co-development with the patient of that approach, what are we going to do together, is probably one of the better ways to address the equity issue. Because in doing that, we're better understanding what the patient is capable of doing, what some of the confounding factors that exist are, what are some of the socio-economic situations that exist, what are the predeterminants of health that exist that we need to be aware of in dealing with the patient to address that equity issue. And at the same time, building appropriately that medication treatment plan. There is a pharmacist who delivered telepharmacy care for diabetic patients here in Boston, and we have the story up on our website. And it talks about how the pharmacist was working with a subset of the population for whom English was not their primary language, and many did not speak English. And through the telephone visits, how she managed to learn about the patient, learn about their condition, have an interpreter available, of course, doing all the things that were necessary to better manage that patient to the extent that the patient could be managed and get the appropriate results. And they've had great treatment and great results in managing their A1Cs. We need to support adherence and self-care. Some of the safety issues are because we don't have the right medications or the right doses for patients, they may experience harm and they'll stop taking the medication. And remember that most of medication care happens in the home, not in the hospital, not in the doctor's office, but in the home. So we have to think long-term when we think of medication safety. We have to apply our expertise, as I said, because that's what we do. We're trained at a higher level. We have to bring that to play in what we do, but always in respect of the patient. And then, most importantly, the essential few. As I said, I don't focus on the word polypharmacy. When I say polypharmacy, many people think of a number, and then they shoot for the number, as opposed to thinking, what are the right number of medications that this patient can manage in order to achieve the outcome that we want? And it might be 8 for some patients, and it might be as few as 3 for others. And the other aspect is that even if we know they need a 4th, but there's no way that they can manage it, are we really doing a service to the patient by forcing them on the patient? Next slide, please. The other principles that are part of medication optimization is, are we ensuring the safety and quality and better outcomes? This morning, there was a presentation around outcomes, but we didn't talk, what about the journey in between? What happens when the patient is first prescribed the medication to when they finally achieve the outcome that we want? How much harm are they experiencing? What else is going on in their lives that's causing us to not have that safe, quality, equitable care that we wanted to have? When we focus on access, we shouldn't focus on just can they get it, but are we giving them the right options? Are we giving them the opportunity to choose the medications that are best for them as well as we co-develop? And it is cost and availability. And how do we balance that cost and availability? We heard earlier how difficult it is when you want to do some outcomes research because people don't focus. They focus on the endpoint. Like, what is it going to cost us for this rather than focusing on, is it less expensive for us to do it over the continuum and extend the patient's life, not have those serious events, reduce hospitalization, all the things that go along with that. Communication with other healthcare professionals is critical, because even in our system where we have all the electronics, we still don't have all of that in place correctly. We still have lots of work to do. Appropriate monitoring becomes important, just as we're saying. If you have the medication to which a patient is extremely sensitive to, are we aware of that? Are we ensuring that we're adjusting medication doses appropriately? But imagine if we could do that ahead of time so that we optimize the patient's journey. And looking at how do you coordinate care for patients in transitions? Because you will have a situation where in a hospital, you may be using pharmacogenomics and adjusting the dose. But when the patient goes to primary care, if that information isn't shared, that doctor may be adjusting the dose differently to achieve what they think is the right outcome without knowing everything else that's involved in that.